Things. I was pleasured to attend the Kennedy Forum last week, and I think one of the things, and potentially Dr. Nathan can attest to this since you had a truncated time for statistics and information. Do you find that what was mentioned by the pastor, drug use, particularly around youth, to have an abstinence-only philosophy negates the core reason why these youths are using any kind of mind-altering substance, might it be alcohol, cigarettes, bath salts that we see. Can you expound a little bit on the root cause of why a young person would choose to use a substance that potentially is illegal for them in the youth, if it's anything under the age of 18, cigarettes when they're 18, alcohol to that effect, and does incarceration and penalties really dissuade that use, given the core reason why a youth would participate in drug use of any kind?
Sure. Happy to answer that. I'll answer the second question first, and that's about incarceration. As everyone here is aware, the United States has the second highest per capita incarceration rate of any nation in the world. And the nation that beats us out is not China, North Korea, Russia, Iran. It's the tiny island nation of Seychelles. And the only thing that the United States really has in common with that little country is the discrepancy between the rich and the poor. And so in the United States, if you are a person of color and you are caught with a little bag of weed, that might not get you into prison, but it will introduce you into a legal system that will then make it nearly impossible for you to get employment, public housing, food stamps, and a whole other host of issues. And it doesn't just affect you, it affects your whole family. And on the one hand, it's a moot point as to whether it deters use, because as soon as you're caught with any small infraction, now you're entered into the legal system, and it's a legal system that people of color are much less able to afford to pay their way out of. And so it perpetuates the poverty of the impoverished. Does it deter use? I would say with 2 million Americans in prison, I'm gonna say no. To your first question, which was more about the reasons why people use drugs in the first place, I'll start by saying that this notion of marijuana being a gateway drug, and bear with me because it actually ties back in. The gateway hypothesis has been around actually since marijuana prohibition began in the 1930s with the philosophy of reefer madness, that, and I quote, marijuana is but a stepping stone to the use of harder drugs, including opioids. And while it is true that people who use people who use hard drugs have generally first tried soft drugs, that's hardly surprising. And the Institute of Medicine, which is a division within the National Academy of Sciences, the Institute of Medicine says that not only is there no evidence of causality between marijuana use and the later use of hard drugs, but marijuana isn't even the best correlator. That prize goes to things like alcohol. And of course, the drugs that are used more commonly are used before the ones that are used less commonly. So that's the gateway hypothesis. So why do I bring that up? Well, first of all, to make sure it's clear to everybody here that that's not a thing. There is no such thing as a gateway to harder drugs that is causative. The correlation is a thing. The question then becomes, why are people getting hooked on very dangerous drugs? And there is a theory that kind of incorporates the correlation that we see between soft drugs and hard drugs, and that is this concept of common liability. There are a whole range of factors that lead people to use drugs to release the pain that they perceive. And it starts when you're young. And it is most likely, if you're coming from a family where you're not having dinner together, or one or both parents are absent for much of the day, either because they're working or they're just otherwise unavailable. If you're not doing well in school, if your school isn't one that cultivates a constructive social or academic atmosphere, these are much better correlates to the later use of drugs. So if you want to eliminate drug use, it's not a matter of making it against the law, and especially not making it against the law for adults. Because when we have marijuana illegal for everyone, then we're saying that marijuana is bad for everyone. And like Molly Lotz was just saying, kids know that's not true. And so they discount what we have to say about the drug. If we want kids to believe us when we say that marijuana can be harmful for them, we need to create a legal distinction between adult use, which is generally benign in healthy adults, and underage use, which recreational underage use is never a good idea. But if we can make that clear distinction, we at least have a chance of helping those kids who are already at risk not enter this world of illegal drugs that marijuana is part of. If they're obtaining illegal drugs as a kid, then they are much more likely to have, illegal marijuana, they are much more likely to have access to illegal cocaine and heroin. Because the dealers, believe it or not, do not check for ID in the same way that legal recreational outlets do.
Thank you. And then one quick follow-up. Do we have any indication of how many adolescent drug use, alcohol use is correlated to adolescents that suffer some sort of trauma or abuse in the home, physical, mental, sexual? Because from what I've learned is a root cause of an individual, especially an adolescent, drinking, using drugs, is to mind alter away from a reality that they're living in that is very horrible cognitively. Do we have any statistics that show that sort of abuse as a foundation for alcohol, drug, or other use?
The simple answer is I actually don't know for sure. I have little doubt that there would be a correlation between those two, which neither recommends nor recommends against whether that's causative and so forth. But certainly, when you talk about common liability, you're talking about kids at risk for a whole range of problems. And if one of those issues is substance use, then yes, the trauma that a kid may experience at home or at school or in the playground may correlate to later use of any kind of substance, whether alcohol, tobacco, marijuana, or others.
Any other questions from members? Representative Morrison.
Thank you, Mr. Chair. I think most of you were in the room when I asked the question about how we address the issue of employers and drug testing and finding qualified applicants for some of these positions that are sensitive, that are dangerous. It goes beyond just what an individual decides to do in the private state of home, but to society at large and the workforce.
From my understanding, for at least Illinois medical cannabis law, you cannot have a commercial driver's license, so that would rule out, pilots and truck drivers and such. But from
talking about just the recreational.
From a recreational point of view, I would say that there are programs I'm aware of that have been testing workers for use. And what's controversial is that once a person's been exposed to cannabis in their body, it hangs out for quite a while. Rule of thumb, about a month or so. And so if someone used cannabis 3 weeks ago and they get in a freak accident that had nothing to do with being impaired at all, and then they're tested, they're gonna find some THC in the blood. And this is an area our addiction specialists will talk about, but it's not the same as alcohol where you take a breathalyzer test. It's a water-soluble substance. You can really measure how impaired someone is. It's a lot more standard across populations, but cannabis is tricky. It's fat-soluble. It stays around. Mm-hmm. So how do you know someone really is impaired? And
well, that was exactly the point in the story I told about my employee, because it's hard to determine, was it just an accident that happens, or was he impaired? That's where the liability is a concern, a major concern, and why an employer would be very cautious or maybe extremely resistant to hiring someone whether they're regular users or not, whether they're coming to work impaired or not. Is that a valid point, do you think? Okay.
Yeah.
And then I'll listen to your response.
Sure. What I would say about that is that we don't want somebody smoking cannabis and getting behind the wheel of a truck or the pilot's seat in an airplane. Anything that would put other people at risk or in some way entails some, real tangible risk is something that of course, public health experts would never condone.
And I'm not suggesting that
No,
you would.
I'm getting
Yeah,
there.
Okay.
But when you talk about testing people for marijuana, which, like Dr. Mendoza-Temple was saying, will hang around in your system for a long time without you having any impairment or intoxication other than the initial hours, then there really isn't a good reason to be testing people for that, other than a kind of moral standard as to whether people choose to consume marijuana in the same way that you could have that yardstick as to whether people choose to drink. And I don't think we want to live in a society where we are going through and deciding, are people really qualified to work in an office if they choose to consume marijuana in their off hours? In the same way that we really would never condone testing people for a whole range of potentially dangerous drugs like opioids or sedatives or stimulants even, all of which can impair driving about the same way that marijuana does. So do we want to be testing for that? I don't think so. People are now using all of those drugs and coming into work. If you want to have a gotcha, then you can get your employee on those grounds. But if what you want is good employees, there are good people out there, contrary to what Attorney General Sessions would tell you, that consume cannabis. And I don't think that they should be penalized in their jobs if those jobs do not involve public safety.
I would also add to that, you could have an employee on prescription opioids. They could have had a few drinks before they came in. And so, in general, an impaired employee is a danger, and that's going to have to be something that the individual business is going to have to determine. If we are in charge of operating cranes in the city of Chicago, maybe you have a zero drug policy no matter what, but throw in alcohol and prescription opioids then while you're at it. Anything that can impair the safe operation of a workforce type of application would be important. It's going to be, I think it's going to be employer dependent.
Okay, I'm just saying, as a former employer, it's not just a judgment on someone's morality. It's the concern about liability. It's concern about employee safety, customer safety, public safety. There are so many factors that I don't think the proponents are really fully acknowledging or considering.
I would disagree with that. I don't think that we're not acknowledging or considering that. I've spent a lot of time talking about this issue and understanding the ways in which cannabis can impair individuals. And I understand the potential for harm. At the same time, the level of impairment you get from any of these drugs is nothing like the level of impairment you would get from alcohol. And you don't breathalyze your employees on a regular basis. And the reason is, if somebody appears impaired, then you take action. If you can't notice any impairment, then there is no impairment, and that goes for drug driving as well. If an officer who is properly trained, and not enough are today, pull somebody over and they're impaired, you may not be able to determine for sure whether it was the Xanax that they took, or whether it was the Percocet that they took, or whether it was the cannabis that they smoked 3 days before. But if they're impaired, field sobriety tests are designed to tell us that. And I will put in a plug for law enforcement's need for better funding of drug recognition experts, DREs. So I think that should be done regardless of whether cannabis is legalized, but I do think that our nation needs to do a better job of assessing actual impairment rather than trying to rely on some per se blood or urine test that really doesn't tell you anything about somebody's impairment.
Coming from Colorado, I work for an organization, it's our local hospital, that does not have allow marijuana use recreationally or medicinally. I don't have to get drug tested to come into work, nor do I have to get drug tested to be an employee there. but they have that as their policy, and I have seen very, very little turnover as far as marijuana policy violations go for the hospital. I also live right at a ski town where there's a huge attraction to marijuana use, and the ski mountain has the same policy that people cannot come to work intoxicated or under the influence. And if there is an incident that happens, that person is then tested, and they are let go right away if they have any sort of substance in their system that would look like marijuana. So there are policies in place that our local community has used to address this, and so far it seems to be working very well.
Representative? Done? Okay. Senator McConkey?
Thank you. Just, I want to follow up on this line of questioning. So, first of all, I'll just state that my understanding from law enforcement and from medical professionals is that not all drug impairments are externally visible. And so this is part of the reason why we have a test for alcohol. If you're over 0.8 here in Illinois, then you are not supposed to be driving. If you're under, then you consider that not sufficiently impaired. We do have a standard that we apply to alcohol. We don't merely leave it to the officer's judgment. I mean, we have driving under the influence and then driving while intoxicated. There's two different standards there and reasons for that. Now, in regards to this question, because it is more difficult, as has been stated, to measure the impairment level, we do have measurements that we have applied for alcohol, the 0.8 standard and such. What kind of tools, if we were to legalize marijuana and want to do so responsibly, what tools do we have to give law enforcement? Because you indicated you didn't want somebody driving a truck who's impaired on marijuana. I don't want somebody driving their large SUV down the road if they're impaired on marijuana, right? And that doesn't have an employer requirement to it. That's just a safety issue. So what tools are available in order to help law enforcement? What would we give them? What exists in order to be able to make these kind of judgments?
But before I let the panelists respond, I just want to note, we did address this in our bill last year that decriminalized possession of small amounts. We set a standard, so that's been done in Illinois. We have a standard, for cannabis. It's 5 parts, I can't remember exactly what it's measuring, and you can do in a saliva test, or 10 parts in a blood test. And there are, I know, at least one, I think it's Carroll Stream, but at least one location in Illinois starting to now use a roadside test that's being developed. This is an area that, as our experts have noted, the science hasn't caught up. It's hard to identify the legal amount versus impairment, but we do now have a tool and a standard that we put in place last year with the decrim bill, and it's consistent with what Colorado and Washington and other states have done. So that was put in place already. Now, please go ahead.
Yeah, so the answer to your question of how do we measure these things objectively is, as I was saying before, the drug recognition experts among police force. And I can tell you in my home state of New Jersey, we don't have that many of them. But when you train somebody and give them the full course of training on how to assess impairment, there has to be some outward measure of impairment, otherwise there is no impairment. It's sort of like if a tree's falling in the woods. And studies do show that drug recognition experts are effective in figuring out if somebody actually is driving while impaired. And this isn't, as I think I said before, this isn't a problem unique to cannabis. This is for all kinds of drugs, because the only drug for which we really have a good per se test, as you were saying, is with alcohol. And I also want to put that in perspective. So when you look at the relative impairment of different drugs, whether that's cannabis or sedatives or opioids or even stimulants, and even hands-free cell phone use, which is not technically a drug, across that range, you have about 2 to maybe 3 times the level of risk for accident, which is not acceptable, right? I mean, that's not what we want on our highways. At the same time, the impairment that you get from a blood alcohol level of 0.08 is about 13 times the risk of accident that you would have otherwise. And if you want to know how intoxication with this whole range of drugs that I just listed compares to alcohol, it would be about like having a blood alcohol level of 0.05, which is legal in the state of Illinois. So the way you know somebody is impaired is by doing a field sobriety test by a drug recognition expert. And I encourage the General Assembly to allocate funds to make that possible.
Do we have any idea what that kind of training then and infrastructure will cost? Because we have one for alcohol.
Yeah, I don't have the
So we do have
numbers.
a cost
You know,
associated that we need to factor
Yeah,
in.
it's a good question, and I've seen the information, but I don't have it at my fingertips. The length of the course, I think, is some small number of days of full time for officers to be trained. So it's not negligible, but at the same time, it can be done, and studies show that it works. And if you like, I would be happy to provide that information to you.
Sure.
Yeah.
And then just as, in summary, I would say that, you've talked about the fact that, field sobriety, and that's driving under the influence. This would be driving under the influence of marijuana use. We do have the question of how do we, address driving while intoxicated or driving, with illegitimate high levels. Senator Staines mentioned that, there is a level in Illinois law. My understanding, though, is that you can't do a blood test without a warrant. Maybe that's something that then, if that's the case, needs to be changed to allow that if there is this question, that the police officer is able to do with alcohol, to have that sort of test run without having to go to the courts together. Thank you.
Thank you, Senator McConkey. You are a great example of why we're having this conversation. Appreciate what you just said. Representative Long.
Well, I'd first say thank you for being here today and giving us your testimony. We do appreciate it. And to Ms. Brace there, I'm not here questioning about MAP, medical assisted programs. I understand that people with opioid problems do probably would like to see medicinal marijuana help them out of their situations. As a matter of fact, I know somebody that who I have confronted recently with that situation. Marijuana helped him out of his opioid problem. Okay, but I gotta say that in a life science study or life science publication, there was a study recently done, November of 2017, I believe it was. People's reactions are slowed by the use of marijuana. We've already came to that conclusion, right? Okay. As a truck driver of 33 years, and having seen many really grotesque fatalities at the wheel, and it's not just truck drivers. It's people driving behind the wheel drunk. Okay. I've seen some very bad situations. What's the difference between, because you say yourself, you don't condone pilots and truck drivers using marijuana and performing their duties, but as a truck driver of 33 years, don't you think that it's just, what's the difference between a truck and a car? If you're operating a car, you're still putting other people's lives in danger, is that correct?
Absolutely. And I don't make that distinction. Neither truck drivers nor pilots nor operators of private automobiles should drive while intoxicated with anything.
Okay, but then what's the hurry to get this done when we don't have the proper testing?
The hurry to get this done is because of the damage being done to American lives every day, particularly in communities of color. As we sat here today and listened to this testimony, several families' lives were ruined by a young person who was arrested for cannabis, and chances are that that person is a person of color. I don't think that we have the luxury of waiting anymore, and after 80 years, I'm not sure exactly what we're waiting for.
Well, you do understand the difference between criminalizing and recreational purposes, is that correct?
That's correct.
Okay, well, decriminalizing is what we did in the state of Illinois. So in other words, We're actually, and I hate to argue with Ms. Preckwinkle, what she stated earlier, but let me say this. We've actually decreased the amount of people going to prison by decriminalizing it. We're not condoning it, okay? They get a traffic citation, maybe confiscate your marijuana, and then you just go about your business. The only ones that are being busted and thrown into prison are the ones that are actually dealing with the marijuana selling, okay? So actually decriminalization is going a long way to decreasing the population in the prison. So I don't see where that's a fair argument. Do you?
Yes, I do. And that is because decriminalization, while I completely agree, is a step in the right direction, and in the state of New Jersey, we don't have decriminalization, and so, you know, the arrests that are made are still in very high numbers. And in the 4-to-1 African American to non-African American ratio that you see nationally, decriminalization doesn't go far enough in that it prevents the government from regulating cannabis, and so people don't know what they're getting. And if you want people to limit their cannabis use, it's very hard to do if they're getting it in an unlabeled package, which is essentially like getting alcohol in an unlabeled bottle, and you don't know how strong it is, and that's a terrible idea. And so legalization at least allows people to know what they're consuming. It allows for testing to make sure that there's no mold or contaminants or pesticides that are banned. Legalization also will further decrease arrests, because in the state of New York last year, in the city of New York, 17,000 people were arrested for minor cannabis crimes. I don't know what it is here, but I'm certain it's higher than it would be if the drug was actually made legal. And the biggest problem with decriminalization compared to legalization is that the point of access, including for our kids, remains in the hands of illegal dealers who don't check for ID and who will either gift or sell harder drugs to adults as well as children. And under a legal system where retailers are very closely watched, that is much less likely, or that reduces the points of access that kids have. You know, my 17-year-old son has said for years that in his high school, which is very ethnically mixed, that it is much easier for him to get cannabis than it is to get alcohol. And that's because the supply chain is already against the law. When we legalize it, when we put it behind the counter instead of on the street corner or in the park, then you are reducing the chances that there will be that diversion from adult to minor.
Okay. I have one more thing I want to say, and I'll ask you this question. As somebody who loves to study economics, I love economics. One thing that has come to my attention is this issue about, well, if we don't legalize it, we're going to create a black market, okay? Or it'll decrease the black market. I have a tendency to disagree, because when you begin to overtax and overregulate things, what happens is you create a bigger black market than what you had before. Okay, so what do you feel about the black market?
Yeah. First of all, I prefer the term illegal market just because of the implicit bias, I think, that you find in the term. So the illegal market is alive and well and has been since cannabis prohibition began. You know, the way, so there is actually a tension between having taxes too high on cannabis, which will perpetuate the illegal market, because it is basically more expensive to produce cannabis legally than illegally, right? Because there are regulations and so forth. And so we have to make sure, at least in the beginning, that the taxes on cannabis are low and that they are graduated. You know, the state that's seeing the most problem with the persistence of the illegal market is Colorado. And Colorado is a state where they really started with too high of a tax rate. And because of that, that helped preserve the illegal market. You know, if you start with lower taxes, drive away the established networks and supply chains, then people will start to buy legally, and that is what you're seeing in most legalized states. And that itself will take care of the illegal market. And the tax rate should then be raised. And it's not just as a matter of revenue, though I think that economically speaking, legalization is a lot less of a burden on our society than prohibition is. But because there is evidence, as with tobacco, that higher tax rates on tobacco actually are well correlated with lower rates of use, particularly among minors. And so it is very important that we have adequate taxes, both to fund necessary programs, but also to try to reduce overuse of cannabis, which already exists.
I have one real quick follow-up question to that.
Yeah, sure.
I agree with you. That might curb a lot of the black market. So then my question to you is, do you really trust your Illinois politicians to keep that in mind?
Yeah, it was Otto von Bismarck who said that politics and stage are two things that you don't want to watch being made. And I get that. At the same time, we've got to come up with a better plan than what we have now. And I certainly think, both in New Jersey and in Illinois, we've got very smart people who certainly have the public's interest at heart. And I am hopeful that in both of our states, New Jersey actually will probably happen within the next few months, and God willing, it would be the same here, that you guys could come up with something that is markedly better than what we have in the era of prohibition.
Mr. Long, if I could address your question, if I could address a proponent of that, or a portion of that question. You talked about the desire to move adult legislation forward, and I'd like to shift the conversation a bit in regard to potential healthcare implications of those that are able to provide or able to access cannabis within a safe legal framework. Adult use legalization does lessen the stigma associated around the cannabis plant. We talked today about how that has happened throughout our country. Secondly, we do note within a variety of research studies that those that are using cannabis across legal markets, cannabis patients and consumers, rate cannabis to be more effective in alleviating the leading symptoms in which they are using cannabis. And again, those are always trouble sleeping. This is documented by the National Institute of Health as a public health problem. Secondly, ongoing body ache, back and joint pain, as well as anxiety. And again, as I mentioned, National Institute of Mental Health and the NIH have done a variety of studies to quantify the impact that help us understand that 130 million Americans are impacted by these symptoms. I would say finally that allowing legal access does allow consumers to not only purchase within a safe retail environment, but also purchase the forms that they find more palatable. Most new entrants to the category are not really interested in combustible forms of consuming cannabis, those being igniting the plant. They are more interested in the forms that allow them more discreet consumption, such as an edible, such as a tincture. Others have mentioned vape pens, things of this nature that allow them to consume the plant without, again, forms of combustion. It does also augment the number of the points made today about the safety of smoking in general. So I think although I don't know if there is a hurry, I do think that there is a significant impact to those that are impacted in the state of Illinois by those 5 conditions. And again, a fair share of those incidents across the state of Illinois indicate that that is 5.4 million adults are impacted by those symptoms.
Duly noted, and I do appreciate you guys' testimony and being here today. I'll hand this back to Madam Chair. Thank you, Madam.
Can I speak quickly on the economics, really quickly?
Briefly?
Yes. In Colorado, the Marijuana Cash Tax Fund, it creates money for education. And with decriminalization, you don't have that. So because there is revenue created and earmarked, we have the tax cash fund that then supports personnel and curriculum to get in the schools to then accompany legalization and youth perceptions of risk and then increasing youth perception of risk. That doesn't happen when we simply have a decriminalization piece to that.
Thank you, ma'am. I have follow-ups from Representative Morrison and Senator McConkey. Just try to be as brief as possible, then.
Okay, thank you, Mr. Chair.
Thank you.
Doctor, in your testimony, your written testimony on page 3, you talked about the increased potency marijuana, that it's significantly stronger, or at least can be grown significantly stronger.
Right.
Why do you think that is? Why do you think that trend exists?
The why of it, I think, is complicated. One is that, as with alcohol prohibition, when you make a drug illegal, then people are going to want to kind of economize the space in which they're going to store that drug. And so that's why prior to alcohol prohibition, beer and wine was almost universally favored over hard liquor, except at the infamous saloons. What happened during Prohibition is that hard alcohol became much more popular, and it actually remained so after the end of Prohibition. And with legal marijuana, I think there is the same kind of mechanism in place to lead to the stronger strains. And I will add, though unsolicited, not obviously an argument in favor of legalization by itself, but there is evidence that the more concentrated and the stronger forms of cannabis with a higher percentage of THC may actually lead to more health problems. And so it's not necessarily a desirable thing, but as somebody here was saying, that when you have a legal recreational retail outlet, it gives people the ability to choose what they want. And what I say to people who will listen in getting educated about adult use of cannabis is that you really should be thinking more in terms of beer and wine than you should be thinking in terms of Everclear. It's not a desirable thing to get a very high THC product. And if it were, then the drug Marinol, which is legal, was approved by the FDA, would be widely used, but it's not. And the reason is that something that strong just doesn't feel good. And so I think it's going to be an adjustment period for people to learn to start using less strong forms of cannabis and roll that back a little bit. And I think people do enjoy their experience more recreationally when they're using milder strains.
One of the earlier panels handed out materials that include the DSM-5 that includes symptoms of cannabis use disorder. Is there anything on there that you would disagree with, or I assume as a psychiatrist that you're familiar with?
Yeah, I've heard of it.
Okay.
Yeah, and actually next year I'm going to be tested on it
Okay.
when I get my board recertification. So the DSM-5, first of all, is controversial even within my field. I use it, partly because I have to, because in order to submit to insurance companies, you have to make sure you're following the rules there. But the definition of what constitutes a disorder is sometimes a lower bar than it should be, for not just in substance use disorders, but in psychiatric disorders generally. And every one of those diagnoses, including the diagnosis of cannabis use disorder, they have a criterion saying that it must cause significant occupational or personal impairment or social occupational impairment in some way. And so there are a lot of people out there who some would diagnose with cannabis use disorder simply by virtue of the fact that they're using cannabis. And a lot of the people, when you hear that such large numbers of people are being treated for cannabis use disorder, most of that is court ordered. And people will take that option in order to avoid a more a stiffer sentence. But that doesn't necessarily mean there are that many people with cannabis use disorder. The numbers that the opposition gave today are actually somewhat close to what I would give as the numbers for the rate of dependence on cannabis, both in adults and minors. So as they said, if you start cannabis as an adult, and that means over 21, your odds of becoming dependent on it are something like 9%. Compare that to about 15% for alcohol, and also compare that to about 16%, which is the exact number they use, for underage users. And that is why we really need to create that distinction, get kids to understand that they just can't be using that stuff until their brains are basically fully cooked. And so the numbers are lower, the percentage of dependents people on cannabis is similar to that for caffeine. Now, nobody is saying that caffeine is as harmful as cannabis or alcohol or anything else. But that is about the rate of dependence, just for reference. But in the case of caffeine and cannabis, having that 9% dependent has a very different implication or set of implications than the 15% of people who are dependent on alcohol, where the drug actually does a lot more damage than it does for caffeine or for cannabis.
Okay, the reason I was asking about the potency question is point number 9 in the DSM-5 for the cannabis use disorders. I'm sorry, point number 10, tolerance to cannabis as defined by progressively larger amounts of cannabis are needed to obtain the psychoactive effect experienced when use first commenced or noticeably reduced effective use of the same amount of cannabis. So that's what I was
Right, but the DSM-5 also says that you don't have to have all of the criteria. That's one of the criteria. It's a marker. And if you are using more and more in order to get the same effect for any drug, whether it's opioids, which, so for any drug, tolerance is pretty much a fact of life. And the more you use a drug, the more you're going to need higher doses in order to at least try to achieve the same effect. So it certainly makes sense as a criteria at DSM-5, but it's not the only criteria.
Thank you, Representative Conley.
There's been a lot of discussion today about the workplace and coming to the workplace impaired or driving impaired. I think we understand that doing either of those has repercussions. Typically, I think when you find somebody who goes to the workplace impaired for whatever reason, you often find an addiction problem. Addiction and what we're talking about now are two very different things. I don't think anybody would question the fact that we have a severe opioid epidemic in our country. Our life expectancy has begun to drop for the first time in over 40 years because of that. So I'm interested to know, in your opinion, doctors, when we are in a position, or if we are in a position to do this and do this right, do you feel that some of the revenue from this could help us to fight mental health and addiction and therefore start to curb some of our deaths? Yes.
I mean, that pretty much said it, and I wanted to speak towards how statistics and data are presented. And when I was cherry picking my favorable hey, let's paint a good picture of all of this, I was really intrigued by the education piece that happens early on, like 8th graders. The study that I've actually provided in your packets noted that when you hit them at a young age and they are scared of this stuff, they're not going to use it as much. So you hit them at multiple points. Of course, now when someone's by the time they're addicted, they've blown way past that, and most likely, there's some psychological pain, some depression and anxiety, and cannabis is one thing you try, and then the drug dealer says, here, try this. I got something else that looks really good. Oh, it happens to be heroin. Oh, I'll try that. I would think they're the gateway drug, but when you have at least, and I know that resources are thin in this state. They're, without overtaxing it and making another illegal market flourish. My message is, as a physician, to protect the health of our young, growing brains and the people on the freeways and everyone else, that we need to educate. And then on the flip side, when it comes to, there's this group of people who, Dr. Weiner and all of those folks who are dealing with the addictions and the dark side of all of this, I see that where their bias comes from. Look, I'm married to an ER doc. He sees these people as well. For me, my skin in the game is taking care of the patients in front of me. And if they're addicted, I want to have resources for them. It's really hard to find someone who will get on the list for the rehab and such. These are long lists. We need more resources. And I don't know where else that revenue is going to come from. So just from a very common sense point of view, this is a potential source to fund programs that are on a mission. So being practical, let's use that for addiction, for prevention.
All of the above, yes.
Thank you, I agree 100%.
Thank you all very much. Thank you all very much for your time and your testimony. Appreciate it. Oh, I'm sorry, before you go.
It's really more just to say there was a couple questions that I can at least respond to in terms of things we are thinking about the bill and why I think it's so important for us to be having these kinds of hearings and getting this kind of information. We are allowing employers to test in the bill. We're going to continue to do that. We have it under the medical marijuana. We are going to continue to allow for that. We do have the DUI standards already in place. Dollars will be spent towards including things like public education, and we can make sure we have those youth education programs in place here. We can learn from other states in that regard. We are planning on having a portion of dollars go towards mental health and substance use treatment disorders, and we are also planning on having some of the dollars go to law enforcement to help do training on things like DREs, and also maybe making roadside tests more available to them as those in fact get developed. We've seen in Colorado that unemployment rates are about the lowest in the country. I know there's concerns about employers, but they're doing very well. And they've also, when we went to visit them, the officials have told us their worker compensation costs have not gone up after legalization, so they have not seen that added to workplace costs. And then there'd also been the cost question about, that was Representative Long, around the reducing the illegal market, not pricing this. We're very mindful that we don't want to put a tax on here too high. We have one from Colorado that we don't want to do that. And we are in fact also contemplating put a cap on how much locals can add in tax for that very reason that maybe not everybody trusts us here in Illinois to not overtax. So we are looking at ways of trying to ensure that. So like Colorado now has, after taxing it too high, they've gone and addressed that. They've now cut into 75% of the illegal market has been gone now. It's down to only just 25% of marijuana being purchased on a legal market as it was beforehand. So they've reduced it 75%. So those are some of the ways, and I also want the last point that had been brought up is about the high dosage. One of the advantages of going to a regulation is that we can regulate that, and every single dose can have only the same amount of THC in it. So you can prevent for that outside the medical. In medical, there may be needs for higher dosages, but in the tax and regulate, we are not planning on doing that. You'll have the same dosage in every single portion. So I just wanted to answer some of those concerns we've heard.
Thank you very much.